The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi everyone, today in Aging Horizons we're going to be talking about suicide prevention with Carl Roston. It's a very important topic, something that really takes place here in Montana many more times than you might know. We're going to talk about signs, we're going to talk about intervention, and how you can help. Please stay with us, we have a lot to show you and a lot to talk about.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kim Everman, and as I said in our open, we're going to be talking about suicide prevention today. With us is Carl Roston. Carl, hi. Good to have you back.
Thanks for having me.
And you are the Suicide Prevention Coordinator for the Public Health Department here.
Yes, I am.
So let's start out, because I always like to sort of lay a foundation. Let's talk about Montana versus maybe national in terms of suicide, I guess successful suicide. What's that looking like these days?
Well, nationally, each year we have more than 47,000 suicides in the United States. But it's important not to hang on the numbers, especially when we talk about Montana. We refer to talk about rate, because that's a more accurate assessment of how much of an issue it is. So nationally, the rate of suicide is about 14.5 per 100,000. But in Montana, it's about 27. So we are nearly double.
Per 1,000?
Per 100,000.
100,000. Wow.
So we are almost double the national rate of suicide. That equates out to being somewhere in the neighborhood of 300 people a year that we lose to suicide.
Why do you think that is? Or wait, why do you know that is? I'm sure you know.
There's a number of factors. First of all, it's important for people to understand it's a multifactored issue. And it's not just our state, it's the Rocky Mountain region. Just about 9 out of the top 10 states are Rocky Mountain region states. And so there's issues around geography as far as a northern state where we have less sunshine, which means we get less vitamin D. We have a high population of the high-risk groups, such as American Indians, veterans, middle-aged white men. Alcohol plays a factor. Almost more than 40% of the suicides, there's alcohol in the system. Of course, we have easy access to lethal means such as firearms. You know, Montana, about 65% of the suicides are by firearm, where it's nationally it's about 50%. Probably one of the biggest ones is stigma. We have that cowboy-up mentality where we don't like to talk about our problems. And that is a major, major factor. We have a lack of behavioral health. We have social isolation, or being a rural state where we don't have access. Even altitude. Worldwide, there's a positive correlation between suicide and altitude. And then socioeconomic, poverty. So there's a number of factors. And really in Montana, we have a perfect storm as far as all those things happening at the same time.
Yeah, we sure do. So how do you work with that, Carl? Do you have a lot of programs and contacts and resources for folks, or how do we get to that 28%? Boy, that's big.
Well, and it's raising awareness for people to understand. We understand it, and with people, stigma, for instance, that's a changeable one, but it takes time. It's going to take a cultural shift in thinking, and that takes time, sometimes a generation or so. So some of the things that can be changed, other things might be a little harder, but we can raise our awareness around making sure that we're screening people for mental health, that we're starting to open a dialogue around making it okay to talk about depression and anxiety. We can make sure that for kids especially, that homes are safe by making sure the medications are locked up and the firearms are properly stored. So there are some things that we can adjust. The rural piece is a hard one, but maybe the use of telemedicine or more programs that focus on rural health care are all things that we need to start to do. But there's a lot of things. It's not going to be one thing. It's going to take a multitude of things to change.
Yeah, I saw before Christmas a sort of a movement on Facebook where they were saying, in terms of mental health, we can't be wearing those kinds of costumes for Halloween. And what I'm talking about is a person from a psych ward, or in fact, I had a friend whose daughter had some issues and was at the psych ward, and I had a teachable moment with my friend and said, no, she's getting help at the mental health unit, but it's not a psych ward.
Right.
So every word we use, the things that it never occurred to me that a crazy person costume could be anything at all in this, but as I thought about it, I thought, yes, that's the stuff we have to keep changing and keep working on, because that stigma, I think, when I think about Montana and I think about the high rates that we have here, I think about stigma right away.
And it starts, a big push that we're doing is with our behavior, or our primary care. We are nationally, it's now a national recommendation that there should be universal screening for depression and anxiety starting at age 12.
Wow.
And that should be done with everybody. And
that would be great.
And it needs to become the next vital sign. In other words, you go in, you get weighed, you get your blood pressure, you get a depression screen. It doesn't take very long. It starts off with 2 questions, and only if you answer positive to them do you go further. But this is something that we need to start to do every time you go to the doctor.
Well, and I'm glad you mentioned that at age 12, because I think that's another place, adolescence, where we don't understand very much, and we need to be sure we're on point helping them so that they don't end up as a 17 or 18-year-old taking their own life.
Absolutely.
So that, I always like to talk that stigma with you, Carl, because it's such a biggie, and it seems like it'd be easy to change, but it's in us.
And especially with parents, because parents lose their objectivity when it comes to their own kids.
Sure.
And so it's hard for a child or a parent to picture their child wanting to die.
Sure.
And so it's another reason why work with your pediatrician or your school counselor and have your kids screened so that you have the information you need to make the best decision for your child.
Absolutely. He's absolutely bang on, folks. Starting early is always the best way. Get proactive, not reactive, and make sure that you're keeping an idea of how your kids are doing, how the people around you are doing. Is there anybody that's particularly sad, that's a friend or a family member, or talking about suicide or not talking about things? So much more that we have to talk about today about suicide. Next, we're going to talk about some of the warning signs that you can use to help. Stay with us.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
In 20 years at an electric utility, I've seen the hardships many of our neighbors face with high winter heating bills.
Ross Holter, Flathead Electric Co-op.
That's why I donate to Energy Share of Montana. I just hate the thought of senior citizens, and young kids especially, being cold in the winter. Donate to Energy Share. Help your neighbor stay warm.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Hi folks, welcome back to Aging Horizons. We're here with Carl Roston talking about suicide prevention. I always call you one of my favorite guests just because you're so great with your knowledge and everything that you do. I mean, obviously the subject is terrible, but there are ways that possibly we can intervene with someone that we might think is got suicidal thoughts going on. First of all, what are the signs that we should be looking for?
Well, first, it's important people understand that more than 70% of the people that die by suicide gave warning signs. So this is something that we are missing.
Yes.
And when we it's also important for people to understand that suicide is the most preventable form of death. So when we talk about the warning signs, when we use a mnemonic called Is Path Warm, and I is ideation, they start to communicate intent of dying. And it's seldom a direct statement because of the stigma. It's more like often an indirect statement, like, it doesn't matter what happens, I'm not going to be around, or everybody would be better off if I wasn't here. Right? S is substance abuse. There's a change in their pattern of use, and this really starts at about age 15 and from there on.
Okay.
But it's a change in their pattern. Either they start to use when they never used before, or they use more and more. The W is withdrawal. They start to, P is purposelessness. They start to give away prized possessions.
Yeah, I was going to ask about that.
Yeah, they give away prized possessions, or there's a deterioration in personal hygiene. A is agitation, so there's difficulty concentrating, lapses in short-term memory, a change in sleep. That is a huge one.
So talk about that for a minute.
Where either they start, many times we think of someone who's depressed as they sleep all the time. And that could very well be, but many times with young people or young adults, we see an agitated sleep where they have trouble falling asleep, trouble staying asleep, wake up many times during the night.
Yeah. Okay.
And there's a sense of tunnel vision where they can't see past the pain, and
like this is never going to end.
Exactly. This is never going to change, and that leads to the H, which is hopelessness. No goals, no sense of future, right? And they start to withdraw, they start to pull away, they stop hanging out with their friends, they stop doing the things that they usually find pleasurable, they stop communicating with family. There's often an increase in anger or irritability, and many times there'll be a sense of revenge and even some of their communications, and that's usually around loss of relationships. Huge factor with suicide. Then we also have a recklessness. The R is recklessness. They start to engage in high-risk behavior, whether it's gambling, spending money, illicit drug use, multiple sexual partners, reckless driving. And the final one is a change in mood. They're not acting like themselves. There's something going on. They're acting out of character. When you see these things, it is critical that people ask the question, and that is, are you suicidal or are you having thoughts of killing yourself?
Right.
It's very scary to do,
Right.
but it is critical that people are able to use the words. There's a myth out there that people think, well, if I bring it up, I could put the idea in the person's head. Not 1 ounce of research to support that. Not one. On the contrary, asking somebody directly, are you suicidal, validates their pain. It opens up communication. It offers hope. It gives the person the opportunity to talk. You can do no harm by asking somebody if they're suicidal.
Right.
And if they say yes, or sometimes, you always want to ask them if they have a plan. Because having just a thought is not uncommon, but most people think the reasons to live, reasons not to die. But for some people it sticks and it festers and it turns into a plan. The more specific the plan, the higher the risk.
Okay.
What do they have access to? This is where we really want to make sure that medications are locked up and firearms are properly stored. And then what's really critical is you never leave a suicidal person alone. You have to take them directly to help, and that looks different, depends on where you are in Montana.
It sure does.
Ideally, what we're now telling people is to contact the Suicide Prevention Lifeline, which should be on your screen.
We'll put it on the screen.
Because they can actually do an assessment over the phone. They're trained crisis counselors that can do assessment, and they can determine if the 911 system needs to be implemented, if they need to be taken directly to an ER, or if the police have to come assist. If you don't want to do that, taking them to your primary care provider or taking them directly to an ER.
Yeah.
Those are the things people need to do.
You know, and none of those, as you said, none of those are hard, or would they make anything worse by acting on them, and making sure that, I guess I can imagine that person, that suicidal person, if you ask them that, they would feel validated. Mm-hmm. They would feel like someone noticed.
Yes, and this is where stigma comes in, though, because even when working with healthcare providers, if you start off the question by saying, "I have to ask you this question," it might seem silly. The minute you do that, that's stigma, and that's going to change how the person responds. If that's your opening, they're going to feel judged, and that's one of the greatest fears that a suicidal person has, is a fear of being judged.
Yeah. And I think, again, you've brought up something that I've probably heard that 100 times. This is going to sound silly, but I need to ask you anyway. And I never really thought of that as stigma, but it certainly is. It puts you in that frame of mind of, oh, they're not going to take it seriously anyway.
Exactly.
So if I tell them, I just expose myself and don't get anything, but maybe they'll laugh at me or something.
Yeah. It's one of the major things that when I train nurses and physician assistants, is that the stigma isn't just in the general population. I see stigma even in our healthcare providers, and it affects our ability to accurately assess risk.
Yeah, and I think with that one, I've always thought it was, an action to try to become more comfortable with the person, making a little contact. But words matter.
Absolutely, it does.
Words matter, folks. Again, we want to make sure that stigma and it is not stopping you from either reaching out yourself. We're putting phone numbers up on the screen, or if you have a family member or a friend you want to reach out on behalf of that person, do it. It'll help that person, it'll validate their pain and keep them safe. We have a lot more to talk about. You don't want to miss it, so come back.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
I have a complete new respect for the Delta. Everyone is going to be exposed to the Delta. This is not the virus that we saw in the beginning of the pandemic. This is so much more dangerous, so much more communicable. People get sicker quicker. Now the question is do we want to have a barrier of protection, of antibody protection via the vaccine? Or do you want to just go at it by yourself? The hospitals are full of people that are unvaccinated, and they are just not full of people that have had the vaccine. The goal is to prevent people from getting hospitalized and dying, and that's exactly what the vaccine is doing.
Hi everyone, welcome back to Aging Horizons. We're here with Carl Roston, who is the Suicide Prevention Coordinator for the Department of Public Health. Glad to have you.
Yes.
So we've talked, Carl, about sort of how Montana stacks up against the national and why. We've talked about a lot of the warning signs, how you can intervene. We've talked about stigma, which we will continue to talk about. Let's just have a talk about good old resources,
right?
Because we don't just get up in the morning knowing who to call if we have a worry about something, do we? So let's talk about the resources.
So we have a number of resources, and it's important when we talk about suicide prevention, it takes a multi-tiered approach.
Okay.
In other words, there isn't one place. You have to start in different places where people are. We actually have programs that start in elementary school with kids, because one of the things we know about suicide is kind of a cliche that they say suicide occurs when when the pain exceeds the ability to cope. And so what we often see is people have poor coping skills, they have poor resiliency skills. And this is something we often learn when we're young. And so one of the programs that we're implementing statewide is a program called the PACS Good Behavior Game in elementary schools with as low as first and second graders that teach kids coping and resiliency skills that have been found to be effective 30 years later.
Wow.
We talked briefly about the need to do assessments starting at age 12, and that could be with your pediatrician or in a school program. So the screening piece is critical. We also have a program called SOS, Signs of Suicide, and it's a school-based program where we actually work with middle schools and high schools, teaching kids the warning signs and how they can help a friend, how they can connect with an adult. We have a great program called YAM, Youth Aware of Mental Health, and this is done in high schools. This is a resiliency program for high schools, for students in high school to teach resiliency skills. We have what we call gatekeeper trainings, which are one's called QPR, which is Question, Persuade, and Refer. And it basically teaches people what are the warning signs, how to intervene. Very similar to what I went over before. But we do this with teachers, we do this with primary care, we do it with EMS, firefighters, law enforcement, faith-based organizations, pretty much anybody in the community that wants to know. We have programs specifically for the elderly where they focus on the screening piece and how to connect the elderly folks to caregivers, and for caregivers to have the idea of how to recognize a sign in their patients or their clients. So it's really a multi-tiered approach, and of course firearm safety, any type of access to lethal means, including medications, is a critical component. Especially in Montana, if you see the warning signs, is to make sure that their environment is safe. Because the more time you create between when someone has the impulse to where they have access to a means, the lower the rate of suicide.
Oh, sure.
So, for instance, we even were working with pharmacists. There was a study that came out in England a couple of years ago where if you gave somebody a bottle of pills and gave them exactly the same medication in a blister pack, the suicide rate drops in a blister pack because of the time it takes to punch out the pills. Firearm safety, if they can't unlock, if they can't get to the ammunition or anything, anytime you have time, it creates the opportunity for ambivalence to set in and fight or flight to set in. And all of those can lower the opportunity for suicide.
Sure. That makes so much sense, Carl. And, hopefully that person would go, oh, no, I can't do that. And also, I just love hearing about the kids that we're trying to interact with. Little kids need to understand the resiliency, like you say, and maybe if it's coming from that age, that stigma's going to go away.
Right, and that good behavior game, that's not a suicide prevention program per se. It's actually pro-social skills. The research, it's one of the most researched programs out there. It's been around for actually quite some time. But it also has been shown to reduce criminal behavior, substance abuse, disruptive behaviors in schools. It actually increases learning in schools or in kids. So this is the type of program that we really need to focus on, giving our kids the skills they need to succeed.
Sure, and and as you were saying, it's not just about understanding suicide then. It's a lifetime of having resiliency in the way that you're coping with issues, which is extremely important, as we well know. Well, Carl, we just have a couple of minutes left. If we have an audience member who is watching and feels suicidal right now, who can they call?
The Lifeline, the Lifeline number, and that's the 800-273-TALK, and it's important that this is a 24/7. It's usually answered in Montana. The way the system is set up is that we have 3 call centers in Montana. We have Voices of Hope in Great Falls, the Help Center in Bozeman, and Western Montana Mental Health in Missoula. A call comes in, it goes, if it's from Montana, it goes to one of those 3 call centers. The way it's set up nationally, though, is that if for some reason those call centers are busy, it goes to the next available call center. It could be in Wyoming, it could be in Idaho. But 93% of the time, that call's answered in Montana.
Good to know.
And they are tied directly into the 911 system. So if they have to do an active rescue, they can. But as I mentioned earlier, these are trained crisis counselors. They can do an assessment, and they can help the caller determine what level of intervention is needed to help them.
Or even if they just want to talk, right?
Absolutely.
Just want to,
definitely.
And we know, we have lines for veterans and we have lines for different groups of people, but this is a great place to start.
Yes.
Is this one, and it's really fantastic to know that 93% of the time it's answered by a Montanan, because I think that makes a lot of difference to Montana.
Absolutely.
Carl, thanks so much for being with us today. You always bring the greatest feeling of hope. Thanks so much.
Thank you. Thanks for having me.
Folks, it just doesn't make sense to ignore these kinds of signs. You want to be there for any of your family members or friends that you are seeing these warning signs from. Speak out. It is not we need to get rid of the stigma. We need to make that stop and make talking about our mental health completely okay, just like if we had high blood pressure or diabetes. For Aging Horizons, I'm Kimmy Everman. Thanks for being with us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.